Hello everyone, welcome back. I am Dr. Alexandra, women's hormone expert. In today's video, we are going to be talking about one of the more little known symptoms that happens as women's hormones decline, and something that I think that a lot of women aren't talking about, but it does happen and they don't know that it's hormone related. So first of all, if you have been following along with our videos forever, we appreciate you. Thank you so much for being here. Go ahead and hit the like button, share this with a friend, because really it's our goal to get this video out to more people to just help them navigate hormonal concerns, because let's get real, sometimes hormonal care can be a little iffy. And then if you are new to our channel, welcome. We're super excited to have you here. Thank you so much for watching. So without further ado, let's dive in. So like I said, we're not talking about the typical symptoms today. We're talking about something that a lot of people don't correlate to changes in hormones, but it really does tie in. And that's musculoskeletal pain. So when was the last time you thought, oh man, I'm super achy, right? Or I'm getting injured, or I have frozen shoulder, and you thought, I wonder if my hormones are off. But that's a question that we should really be asking. And it's a question that more doctors should be asking, because oftentimes what ends up happening is we end up going to kind of an orthopedic surgeon and we go to our gynecologist. Nobody's talking to one another. But up to 80% of women in menopause can have musculoskeletal pain. And 25% of those cases will be severe, being that it will greatly debilitate their life. And what's interesting is that I mentioned frozen shoulder, right? So today we're kind of talking more about the menopausal hormones, but in cases of frozen shoulder, we know that women who have frozen shoulder are more likely to have hypothyroidism. And so if you're going to your orthopedic surgeon for your frozen shoulder, you're really going to want to say, hey, who's going to run a good thyroid panel on you, because they correlate. So when it comes to musculoskeletal pain, I think this is important because a lot of the time we see patients that come in our office all the time that say things like, I'm falling apart, right? I just became 50 and now I'm falling apart. Or I just became 48 and now I'm falling apart. And a lot of this falling apart feeling does have to do with some of maybe the traditional symptoms that we're thinking about: hot flashes, night sweats, insomnia, mood changes, but a lot of the time it's physical. And that, I think, is a symptom that really gets brushed off in medicine, right? Oh, take an Advil, take an anti-inflammatory, take a bath, do some Epsom salts, right? And that's kind of our treatment plan. Well, what if that's not good enough? Because what if it's hormonal related? So we know, studies show that younger women who have higher levels of testosterone have better pain tolerance. And their studies also show that estrogen impacts our muscles' energy production and kind of the way that muscles grow and regenerate. And so it makes sense that as we age and as our hormones decline, that musculoskeletal symptoms might be one of the things that we need to think about, right? Now, this isn't on like the normal reasons why we would prescribe estrogen, but this is why looking at your entire body system as your hormones decline is really, really important. So this might be, right, that you're somebody that's getting injured, and you might not even be menopausal yet, but it might be somebody that's getting injured that is just unable to heal anymore, right? It might be somebody that's getting weaker as they age, so where their muscles are feeling a little bit more tender, a little bit less likely to recover, and a little weaker, right? Because sarcopenia, which is the loss of muscle mass as we age, is actually a really big deal, because that impacts our risk for falling, and it greatly decreases our quality of life. And so the musculoskeletal issues that come with menopause, I think, is something that we need to kind of open a discussion about. And I'm wondering in the comments below how many people have had some sort of injury and actually had their doctor say, hey, let's look at your hormones and let's see if they are in the right capacity to allow your body to heal and recover appropriately. Because really, that's kind of the goal of regenerative medicine, is being experts in helping the body heal so that it no longer limits you. And I think a lot of the time in menopause, we take our limitations as just like, okay, well, we're just 50, and so these limitations are what we get in life. And I don't believe that. And so I hope this video is helpful for you if you have had any musculoskeletal symptoms as your hormones have started to decline, and kind of just point you in the right direction. And I want to know in the comments below, if you've had musculoskeletal issues, if anybody has ever run a hormone panel on you. And we'll see you next time for next time's video.